Today's topic is quite short, but it's still very important in intensive care. So, topic is defibrillation and cardioversion. Before knowing defibrillation and cardioversion, we must know the machine we are using for that. That is called as automated external defibrillator. That is AED. So, it is lightweight, portable, computerized device identifies rhythm and shocks automatically. So, what is defibrillation? Before that, we must know what is fibrillation. Fibrillation is irregular, disorganized rhythm or an abnormal rhythm. So, stopping this abnormal rhythm is called as defibrillation. The defibrillation stops a quivering heart or a chaotic rhythm of heart for a millisecond in hope that it will regain its normal rhythm. Okay, so effective heart rate is regained and pulse is palpable. The condition is called as ROSC. So if after defibrillation we immediately start CPR. If we are able to palpate the pulse and the circulation attitude, that is called as return of spontaneous circulation. So signs of return of spontaneous circulation include breathing, coughing, pulse, and measurable blood pressure. So what are the indications for defibrillation? The indications for defibrillation are pulseless VTAC and ventricular fibrillation. And commonly used defibrillators are monophasic and biphasic, but nowadays most commonly biphasic defibrillator is used. So energy mostly used is 2 joule per kg. In case of biphasic, initially 100 to 120 joule and maximum we can use 200 joule. So what are the differences between defibrillation and cardioversion? So defibrillation is asynchronized shock given with AED, whereas cardioversion is synchronized shock. We know that as soon as we put on the machine, we sync the button, charge it, and then we give shock. So it is synchronized with R waves or QRS complexes. So cardioversion is synchronized shock, and defibrillation is asynchronized. Okay. Defibrillation uses a higher energy, 2 joule per kg, that is 120 to 200 joule, whereas this cardioversion uses lower energy, starting with 50, then 100, 150, 200 joule. Other difference is the defibrillation is done in unstable patients. We see that code blue is announced and we run to patient. Patient is collapsed, unconscious, and we give shock. It is shockable rhythm, but cardioversion is done in a stable patients. Usually it is done in a stable patients. So defibrillation is an emergency procedure, whereas cardioversion is a planned procedure. So in defibrillation, patient is usually unconscious, collapsed. In case of cardioversion, patient is conscious. So most of the time patient has chronic atrial fibrillation, we take consent, give sedation. Even we give anticoagulation, there are chances of embolization of the clot because of atrial fibrillation, so we need anticoagulation occasionally. And indications for defibrillation are pulseless VTAC and ventricular fibrillation, whereas indications for cardioversion are ventricular tachyarrhythmia, like VT with pulse, supraventricular tachycardia, atrial fibrillation, atrial flutter, and patient is hemodynamically unstable. Okay, this is short topic but still important. Thank you.